in rural areas, 70% of epileptic patients in India, they are not treated, inadequately treated or wrongly treated.
The strokes have been increasing episodes in the age of 30 to 40.
Because of increased prevalence of blood pressure, sugar at earlier age.
Dr. Parkinsonism is getting much more common, or is it that we are diagnosing it as a very earlier stage?
Might be increasing little bit because of additional lifestyle changes and environmental factor.
Can Alzheimer be delayed or prevented from happening?
Yes, Alzheimer can be delayed by a good lifestyle.
Doctor, what are the golden hours of stroke and what are the symptoms?
The dementia is progressive in a stepwise pattern. It could be because of multiple damages, small clots in the brain.
What are the symptoms of migraine which one should really worry about?
Many of these people have a nausea, vomiting, blurring of vision, tingling sensation over the limbs.
Can Botox be used as a treatment of headaches, and how does that actually work? Hello everyone and welcome back to the official podcast series of Lilavati Hospital and Research Center. At this very second, your brain has been sending you millions of signals without you even noticing. You're able to walk, to see, to talk and solve problems because your brain is functioning in silence. It is one of the most sophisticated organs of the body, yet the most mysterious one. There have been various advances in neuroscience, but neurological disorders remain one of the leading causes of disabilities worldwide. Good news is that earlier diagnosis, better treatments and greater awareness have improved outcome like never before. To understand this topic better, today we are joined by Dr. Girishkumar Soni, one of India's leading neurologists, a senior consultant neurologist at Lilavati Hospital. He is known for his work in stroke, epilepsy, migraine, headache, movement disorders and various neurological disorders. He has a unique approach of a blend of clinical excellence and patient first. He has been able to help various patients approach and navigate through various neurological disorders and brain disorders. Thank you, doctor, for joining us today. It's a pleasure to have you.
Pleasure.
So, doctor, starting with, the strokes have been increasing episodes in the age of 30 to 40. We would like to know the reason behind it.
See, previously the stroke, which is a cerebrovascular accident, we used to see after the age of 50-55 age group. The important risk factors are blood pressure, diabetes, underlying heart disease, high cholesterol. But nowadays we are seeing a lot of young stroke patients, even at the age of 20, 25, 30s. Because of increased chances of blood pressure, increased prevalence of blood pressure, sugar at earlier age, relatively sedentary lifestyle and increased obesity risk in the younger population, some factor of stress, lifestyle, dietary factors, they are also playing a role in this. So yes, of course we are seeing a lot of younger stroke patients because of change in the risk factors and appearance of these risk factors at earlier age.
So our younger generation should not be in the misconception that stroke affects in the above age.
Only older
Definitely.
people know.
Doctor, what are the golden hours of stroke and what are the symptoms our audience usually miss it or confuse it with something else?
See, golden hour means for even heart attack as well as brain attack. The stroke is also called as brain attack. The golden hour is the period when the cells of our body struggle for the blood supply. If you give them blood supply, these struggling cells or dying cells, they can completely revive back and patient can improve faster, completely and earlier. So with brain, this golden period or window period is 4.5 hours for injectable therapy. What is injectable therapy? Here we can give a injectable drug through a vein that can lyse the clot, that can burst the clot and restore the blood supply to the brain. Okay, so we call it as a IV thrombolysis. So previously this window period or golden period was 3 hours. Now it has been extended to 4.5 hours, even up to 9 hours in selected patients. And this selection is done on the basis of imaging as well as clinical approach by the treating neurologist. Then there is other mode of therapy to treat the clot or the blood vessel occlusion. And this is called as mechanical thrombectomy, where we go through the blood vessel or we go through inside the blood vessel, and wherever there is a clot in the big blood vessel, we remove that clot mechanically, and this is called as mechanical thrombectomy. And up to 10 hours we can do the mechanical thrombectomy, and in selected patient we can do the mechanical thrombectomy up to 24 hours. So ideally speaking, the golden hour for stroke is up to 24 hours. Earlier you approach to the nearby hospital, it's always better. Please remember, every second counts in brain attack, because per second whenever blood supply to the brain is affected, in every seconds more than 20 cells of the brain they die. So time is brain, particularly in stroke cases. So please rush to your hospital as early as possible. Let me give you some knowledge about the symptoms of the stroke, how to identify these symptoms. So I will start the symptoms from eye down. Sudden onset. See, any blood insult with the body, they come suddenly. Sudden onset, loss of vision. Inability to see one side of the field of the vision. I'm not able to see one side, doctor. So sudden onset of loss of vision on one side of the vision, or sudden onset of loss of vision in the one eye. Sudden onset of speech difficulty, not able to speak, or face getting turned on one side. I'm sorry, I'm showing it. Then sudden onset of weakness on one side of the body. Doc, see, I cannot raise my limb the way I am raising this limb. So sudden onset of weakness on one side of the body, sudden onset of imbalance on one side, sudden onset of not able to speak at all, not able to understand what the relatives are telling us. So there are lot of symptoms of stroke. Then rarely stroke can present to you with sudden onset of vomiting, giddiness, imbalance while walking, double vision, swallowing problem. Even sudden onset of memory loss, sudden onset of unconsciousness can happen with stroke. So anything sudden onset that points towards the brain, please reach to your nearby hospital as early as possible, and you need to undergo for the brain imaging.
So recognizing symptoms can definitely differentiate between recovery and permanent disability.
Most common symptom overall in the society is speech difficulty and weakness on one side of the body.
Moving on, doctor, is memory loss always related to Alzheimer, dementia, or it can be mimicked by poor sleep or stress also?
See, nowadays there is one common terminology with the society people, particularly in those people who read Google, brain fog. See, brain fog is not necessarily always memory problem. Brain fog could be because of fatigability, sleep disturbances, vitamin deficiencies, dehydration, or attentional concentration problem of the person, or it can be very early memory problem. See, dementia means progressive problem. Progressive loss of memory affecting daily functioning of the person, where the occupation, education, day-to-day routine activities are getting affected by this memory loss. So person forgetting 10 times, 20 times in a day, and every passing days, every passing weeks, this problem is increasing, and relatives are noticing this problem is getting increased. That is dementia. If person is forgetting where the pen has been kept, next day where my mobile I had kept, that is not dementia. Okay, that is attention or concentration problem. So to label someone as having dementia, the problem has to be progressive. The problem should affect the day-to-day routine life of that person. So in dementia, which is a broader terminology, there are many components. Memory loss, behavior problem, personality problem, then writing problem, reading problem, face recognition problem, problem in navigating in the known surrounding. For example, inside my home, I am searching for the bathroom. Inside my home, I am searching where my temple is there, my home temple is there. So navigation in known surrounding. Then hallucinations, psychosis, they all come under the component of dementia. the dementia which involve the memory domain prominently, we call it as a Alzheimer dementia. When dementia prominently affect the behavior problem, personality problem, capability to take the decisions, getting easily irritable, angry, not talking with the relatives. So this comes under the category of frontotemporal dementia. So of course, apart from Alzheimer dementia, there are other types of dementias. And mind me, the treatment drugs for each type of dementia, they are different. Certain types of drug which we use in Alzheimer dementia, they can worsen other type of dementias. Then if the memory problem is prominently associated with behavior, personality and visual hallucination, seeing the things which are not real. For example, there is a snake over here, there is a god over here, my Nanaji, Dadiji, my grandparents, they are sitting here. These are visual hallucination. If these things are coming in the picture, along with Parkinsonism, it is diffuse Lewy body dementia. The second most common type of dementia in the society is this diffuse Lewy body dementia after Alzheimer. Then if memory problem is associated with some behavior problems, slowness, walking difficulty, urine control difficulties, and the dementia is progressive in a stepwise pattern, it could be because of multiple damages, small clots in the brain. We call it as a multi-infarct state, where the vascular risk factor like blood pressure, diabetes, obesity, cholesterol, sleep apnea, they has not been treated well or poorly controlled. So Alzheimer dementia followed by diffuse Lewy body dementia, multi-infarct state, frontotemporal dementia, these are the common type of dementia that we see in the society in routine practice. Nowadays, there are n number of treatable dementias that we see, which are relatively rapidly progressive. 1 month, 2 month, 3 month history of memory loss, behavior problem, personality problem, sleep problem, psychosis, hallucination, plus minus some other neurological features. So here we suspect person having autoimmune dementia, our own immunity attacking our brain cells, and these types of dementia, they are very well treatable. So separating degenerative age related dementia versus treatable dementias, they are a very important things or parameter as a clinician and for you people also. So of course, whenever you notice anyone having progressive dementia, please see your neurologist. The speed of progression is also important. Please make sure whatever history you are giving to your neurologist, it is right. Sometimes person having dementia from 2 years and we tell the relatives it is theirs from last 2 months or 3 months. So this history is also important. So if you tell the neurologist 2 months person is having dementia, then it comes under the category of probable rapidly progressive dementia. So our flow of investigation, flow of thinking, it completely changes. So duration and symptom complex. Symptom number 1, symptom number 2, symptom number 3, they tells us in which direction we are heading, which type of dementia it is. Of course, at times thyroid issues, vitamin B12 deficiencies, sleep apnea, snoring, they also can cause dementia. And all these things, they come under the category of treatable dementias.
Doctor, that was really an insightful information and our audience to understand the different types of dementia. Since we are on this topic, can Alzheimer be delayed or prevented from happening?
Yes, Alzheimer can be delayed by a good lifestyle. So here, food and physical activity and sleep, these are the 3 important parameters. Number 1, food. There are food that boost the memory, boost the chemicals which are responsible for memory or involved in the memory circuit. These foods are dry fruits like akroot, dates, badam, non-vegetarian food, particularly white meat like fish, chicken, then certain fruits like berries, strawberry, blueberry, cranberry, etc. Even dark chocolate. Physical activity. Those who do at least 30 minutes of good walking, jogging, swimming, or playing a badminton, table tennis, at least 30 minutes, 5 days in a week or 3 days in a week, they have 50% lesser chances of developing dementia in the future. It has been scientifically proven. And number 3 parameter is sleep. We must sleep at least 6 to 7 hours in a day in a left lateral position, because sleeping in a left lateral position, it improves the glymphatic system of the brain. The glymphatic system of the brain, it is a new terminology that came in last 3-4 years, and the science of this glymphatic system is completely changing. Roughly we can say it is a lymphatic system of the brain. So glymphatic system functions maximally in REM sleep. There are types of sleep and in a deep sleep. And this glymphatic system, it drains or removes all the toxic chemicals from the brain. So the function of this glymphatic system is maximum in the deep sleep, in REM sleep, in those people who sleep at least 6 to 7 hours, because in this sleep we get a good amount of REM sleep. So this glymphatic system drains all the toxic chemicals, including chemicals that cause Alzheimer dementia. So please make sure we all are sleeping for 6-7 hours. Lateral position is always better, and that to left lateral position.
Doctor, that's really reassuring to hear about Alzheimer. Moving on, about migraines, which are usually dismissed at basic headaches. What are the symptoms of migraine which one should really worry about?
See, migraine is a common disorder in the society. Almost 8 to 10% of people, they suffer through a migraine. It's because of chemical electrical changes in the brain. There are many types of migraine which we are not going to cover. It is a headache disorder where person develop moderate to severe intensity headache, making them irritable, forcing them to take a rest, making them sound resistant or sound sensitive. Even migraine people, when they communicate with each other, their headache increases. When they talk, their headache increases. When they listen loud noise, their headache increases. Many of these people have a nausea, vomiting, blurring of vision, tingling sensation over the limbs. So any moderate severe headache affecting the person's calmness, emotionality is migraine unless proven otherwise. Most of the time it is a long duration headache. Any headache that lasts more than 3 hours is long duration headache. Normally migraine lasts for 4 hours to 3 days. In most of the individual, half day to 1 day. If they take rest, if they take some painkiller, their headache settles down. So again, when to treat such migraine? Those who have an infrequent migraine, say 1 episode in a month, 2 episodes in a month, SOS painkiller is enough. Rest, ice application over the head. Even nowadays, hot bands, cold bands, head bands, eye bands, they are there in the market. They came just in last 6 months to 1 year only. You can put a cold compression or cold band over the head and eyes. That also gives an immense relief with the headache. If the headaches are frequent, more than 4 episodes per month or more than 1 episode per month, definitely you should consult to your neurologist or to your family doctor. Here we can start a preventive therapy. So this preventive therapy includes lifestyle changes and drug treatment. Of course, lifestyle changes are also needed for those who have an infrequent headache also. So in this lifestyle, a good 6 to 7 hours of sleep, taking your food on time, avoiding excessive coffee, tea, other beverages, alcohol, etc. Keeping your anger, stress factor under control. Of course, seeing your screen in a limited fashion. And if you are going in a sunlight, using goggles, cap or umbrella. In India, the most precipitating factor for migraine is sunlight. And then irregular food intake habits. So please, lifestyle changes are always needed who are migraine here. Then preventive therapy. To reduce the frequency of headache, intensity of headache, severity of headache, there are n number of preventive therapies, preventive drugs. And we select a particular drug for that person depending on their other comorbidities. If the patient is female planning for pregnancy, we select a particular drug. If the person is having sleep issues, anxiety issues, depression issues, neck pain issues, obesity, back pain issues, tingling sensation in the limbs like nerve pain, we select different type of drugs depending on their age, sex, weight, other comorbidities associated. So yes, once we start this preventive therapy, and if the migraine frequency reduces dramatically after a period of 6 months, 9 months or 1 year, we stop this preventive drug also. In almost 90% of people, they enjoys a good life after that. There are some people, 10 to 20% of people who need this preventive therapy for a longer time. 2 years, 3 years, 5 years, we decide person to person in such situation.
Doctor, wearable watches and smartwatches have been increasingly used by people. So, are these devices actually helpful in catching silent diseases or earlier symptoms like AFib or stroke?
For atrial fibrillation, see, among the cardiac cause, the most common cause that can cause stroke is cardiac rhythm disturbances, that is atrial fibrillation. Smartwatches, yes, they have a good role in detecting the atrial fibrillation in almost 70-80% of people. Those who have a paroxysmal atrial fibrillation, I think in such situation, Holter, clinical evaluation, they are much better than these smartwatches.
Doctor, epilepsy is still a stigma in society, especially in India. So, what do people mostly get wrong about in this disease?
See, there is one terminology. We call it as a treatment gap in epilepsy. This means percentage of people who are wrongly treated or inadequately treated or not treated for epilepsy. Believe me, this treatment gap is very high in India. In urban countries, it is still 30%. In rural countries, it is almost 70 to 80%. Means in rural areas, 70% of epileptic patients in India, they are not treated or inadequately treated or wrongly treated. So this gap filling is very important stage or very important step in India. So there are many disbeliefs or wrong perception about this disease. Many of the people, they believe this is anger of the God against us. The God is punishing my body. This is something else. We should go to some God people who जो हमारी नज़र उतारेगा, जो कुछ तो कर देगा. So they start treatment with this. After that, they go to some local doctor who say person might be faking it. The person might be bringing his or her stress by this mean, by becoming unconscious. So many of these people, they think the epilepsy is a fake thing. They are bringing their inner negative energy, negative emotions out by becoming unconscious. Then many times they has been treated with some wrong treatment. There are many types of epilepsy. Some of the epilepsy, they get worsened by certain drug. Some of the epilepsy, they doesn't get controlled by a certain drug. Still in rural areas, there are certain drugs like phenytoin, phenobarbital and carbamazepine. Only these 3 drugs are available in many rural areas of the India. So many times they cause lot of side effects, lot of trouble to the patient, and patients stop this treatment. They start the treatment, they notice some side effect and they stop the treatment, and again they develop repeated epilepsy, blaming that the drug is not working or drug is causing trouble to me. So non-compliance, false belief, inadequate dosage of the drug, and then last factor, particularly in India, is the cost factor of the drugs. See, many of our people, they are poor or from lower socio-economic group. They may not be able to afford the cost of the drug, and they start the treatment. They take for few days, few weeks, they feel better and they stop the treatment because of this cost issue.
Doctor, by what you said, dispelling the myths around the disease is as important as getting the treatment. With AI coming in picture right now, how doctors currently, specifically neurologists, are using it to read brain scans and diagnosing the diseases?
So you want to ask role of brain scan in diagnosing diseases?
AI as well.
AI. See, the role of AI is definitely advancing with the image reading. Many people are taking the imaging plate and they are giving these plates and images to the AI, and AI is giving them a nice reading with lot of differential, lot of reading, and the relatives read whatever diagnosis given by AI and they come back to us. Doc, you said this is the diagnosis and AI gave us this information. See, AI definitely we can use in a stroke patient, particularly in window period. See, AI give us all the readings, all the parameters that can help to decide when to thrombolize this stroke patient. For example, if some patient is coming at 7 hours with stroke, which is out of this routine 4.5 hours of window period, but up to 9 hours we can still thrombolyze according to the new guidelines. So here we take the help of AI. So AI tells us this much brain is damaged because of blood clot, this much part of the brain cells or brain part is fighting for the life. If you give this injection, this part of the brain can get reverse back to normal. So we go for the injections here. So AI give us diffusion perfusion mismatch percentage. How much percentage of brain can be salvaged even if we go with this clot busting treatment. So the communication with the patient becomes very easy. Look, we are out of the window period, but still there is a part of the brain which is still struggling to come back to normal. We should go ahead with this injection. So all the readings AI gives. Even in dementia cases, the AI gives a volume measurement of the memory area of the brain. So that can also help whether the patient has Alzheimer dementia, mild, moderate. That grading also we can do on the basis of this imaging help with the help of AI, of course. So of course it is helping us, but the use should be in a proper fashion or proper manner.
A doctor's touch is also important as the technology. Doctor, Parkinsonism is getting much more common, or is it that we are diagnosing it as a very earlier stage?
I think it is same, might be increasing little bit because of additional lifestyle changes and environmental factor. Definitely we are diagnosing it very early because people are coming early, they are picking up the symptoms of Parkinson early. In fact, lot of people, they come to us and they tells us I am having Parkinson rather than giving their symptoms.
Doctor, we had discussed epilepsy earlier. So what should someone do if they see or witness a person having a seizure in their environment?
See, there are many misconceptions of how to treat that person when that person is getting fits or epilepsy. Many people, they take metal or they take sandal or shoes with a bad smell, and they take this metal, they try to put that metal in the hand of the patient, or they try to put spoon or metal in the mouth of the patient, or they bring the onion or the sandal or the shoes near the nose of the patient. Nothing of this helps the patient. In fact, bringing a metal or sharp object near the body of the patient can cause injury to the patient. So the first and most important thing when someone is getting fit, to make them to lie on one side, lateral side, and to wait for the fit to get over, or to look at the tongue of the patient, whether the tongue is getting stuck between the teeth, or whether the tongue is getting badly fallen back over the throat. See, if tongue is fallen back very badly over the throat, it can impair the respiration. If the tongue is getting stuck between the tongue, it can get badly injured. So make sure or try to make the tongue position better if it is feasible from your side. Because in the seizure, there are many phases of seizure. Okay, if the mouth is closing, opening very badly, or mouth is closed very tightly, even you cannot put your own finger in the patient's mouth, otherwise you will cut your finger. So two most important thing is make sure that you are taking the body of the patient in lateral position and you are trying to safeguard this tongue and wait for the fit to get over. Normally most of the fit, they last for 1 to 2 minutes at the max. This is followed by some period of unconscious spell for 2, 5, 10 minutes, and after that patient regains his consciousness, remains in some sleepiness, confused state for 5 to 30 minutes, and they become normal. Once they become normal, meet your doctor. If the person is getting fits again and again repeatedly, one fit, second fit, third fit, reach to nearby hospital as fast as possible. Or if the fit is getting continued for more than 5 minutes without getting stopped in 1 or 2 minutes, reach to the hospital as fast as possible.
Doctor, can epilepsy affect a person's way of living a life? Can they work, drive, or live a completely normal life?
Yes, all epileptic, they should have a normal life until there are certain grey zone areas also or some outliers also. Normally if someone get fits, we always request them avoid driving alone avoid standing at the edge of the building alone, and avoid going into the swimming pool alone for at least 3 to 6 months. The ideal is 6 months, because the maximum chances of recurrence of the seizures are within 3 months, within 6 months. Once they achieve a good seizure freedom with a drug over a period of 3 months, 6 months, overall we request them, enjoy your normal life, keep a good sleep habit. There are certain type of fits, they can get worsened with bad sleep deprivation, too much of alcohol intake, or those who are taking pills, epilepsy pills, missing the pills. So missing the pills, too much of sleep deprivation can bring the fits again. They can have a normal life, no doubt.
Doctor, we also mentioned about headaches. So, can Botox be used as a treatment of headaches, and how does that actually work?
See, there are many types of headaches. Most common in the society is migraine, followed by tension type of headache. And among these headaches also, we classify headache into two subtypes. Episodic headache, where the headache comes, goes. If they are frequent, we call it as a frequent episodic headache. If they are infrequent, we call them as a episodic infrequent headache. And those groups of headache where the headache lasts for most of the days. If someone is having more than 15 days of headache per month for more than 3 months, we call them as a chronic headache. Or headache lasting for 30 days in a month is chronic headache. So this chronic headache group people, they respond fantastically to Botox. So almost 80-85% of people who have a chronic migraine, they respond to Botox. No side effect of the Botox, and the effect of this Botox remains for almost 6 months to 9 months. Of course, we may need to repeat again Botox after 6 to 9 months.
Doctor, when we talk about tremors, are it usually related to neurological disorders, or can it usually be harmless?
Tremors can be a presentation of many diseases. They can be associated with many diseases. Of course, tremors are neurological, at times caused by drug. Of course, this drug affect the neuroaxis, that's why tremors are caused. There are some physiological tremors which we need not to worry. Physiological anxiety-induced tremors, low sugar-induced tremors, thyroid diseases-related tremors, we call them as a physiological exaggerated tremors. So apart from other tremors, we need to evaluate such patient. Overall, most common cause of tremor in the society is essential tremor. After essential tremor, Parkinson tremors, and then drug-induced tremors. So all need to be treated.
Doctor, if somebody has not heard about EEG or EMG, so can you help our audience understand these tests better?
EEG is nothing but a electroencephalography. It is ECG of the brain, where we record the electrical activity of the brain. The use of this EEG are in two situations. One is epilepsy or seizures, to diagnose the epilepsy, to classify what type of epilepsy the person is having, how we should investigate further this patient, which drug is the best drug that we can use for this person depending on this abnormality of EEG. Even we use the EEG when to stop the treatment, how to stop the treatment, to make that decision. Of course, whole decision is not based on EEG. So diagnosis and management of the epilepsy, number one, for that use. And number two use is in ICU patient, in those who have a unconsciousness or alteration of consciousness. In many situations, it helps us to diagnose what could be the cause behind this unconsciousness. In many situations, it helps to prognosticate the intensity or severity of this encephalopathy, whether it is mild, whether it is severe. We can use the follow-up EEG also to look for the recovery from this coma. Documentary investors. So for diagnosis and for prognostication of encephalopathy, for diagnosis and for prognostication and for management protocol for epilepsy. So these are the two main disorders or diseases where we use EEG. EMG. I will use the terminology electrophysiology. In electrophysiology, we do the nerve conduction studies, we do the EMG, electromyography, we do the repeated nerve stimulation study, we do SSP. Then we do certain electrical tests for vision, for balance also. So this is all electrophysiology. The most common electrophysiological test that we do is NCS EMG, nerve test and muscle test. So these tests are done whenever nerve or muscle of the person is affected. Nerve disorders, muscle disorders, we call it as a neuropathy, spondylosis related radiculopathy, and various muscle disorders. So they have a good diagnostic value.
Doctor, since you mentioned neuropathy, how does a neuropathic pain feels like and how it is differentiated from a regular muscular pain?
So neuropathic pain, it has a typical character. The patient presents to you with tingling sensation, paresthesias, we call it as a junjunat, mungi, electric shock-like sensation, severe sharp shooting pain. So from the patient description, we come to know this is a nerve-related pain or neurogenic pain. While muscle pain is a deep-seated pain, boring pain, cramp-like pain, or at times muscles undergoing into spasms. So it's very easy from the patient description to differentiate between nerve pain versus muscle pain.
Doctor, what is the last message you would like to leave our audience with?
See, brain, neurological disorders, they are very vague, very complex. There are a lot of diseases with neurology, dementia, headache, vertigo, stroke, epilepsy, movement disorders including Parkinsonism, then spine-related problems, spondylosis, spondylotic myelopathy, radiculopathy, nerve problem, nerve and muscle junction problem like myasthenia gravis, then muscle problems. Lot of these things comes under the umbrella of neurology, and each and every disorders, they carry their own different subgroups. If you notice any neurological disorder, please visit to your neurologist as early as possible. There are n number of neurological disorders which are completely treatable, curable. Of course, there are neurological disorders where still treatment is not available. We call them as a hereditary neurological disorders or degenerative neurological disorders. But science is evolving. Many drugs are coming for even previously what we used to call untreatable neurological disorders. The drugs are coming. Though you are going through or suffering from an untreatable or hereditary or degenerative neurological disorders, be in touch with your neurologist regularly. If some treatment comes, that doctor, that neurologist can guide you, look, this drug has came, we can go for this treatment. Okay? So eat healthy food, keep on doing a good exercise, keep a good sleep habit, keep your brain healthy. Thank you.
Thank you, Doctor, again for joining us today.
Thank you.